As we speak, the Senate is voting on the confirmation of Rachel Levine to be the next Assistant HHS Secretary. What does this all mean? As of a couple minutes ago, the last update I had was 45 to vote yes, 37 to vote no. Levine then would need 5 more votes for confirmation. It is expected to happen. What does this mean for HHS? What does this mean for us? To discuss it is Roger Severino, who is a senior fellow at the Ethics and Public Policy Center, but recently served at HHS under President Trump. Roger, welcome to the program.
Glad to be back.
Well, Roger, tell us what this confirmation means for this agency and for Americans who are just watching this.
This is a scary time in American history. The question is, will ideology be put ahead of science? Biden said he's going to be listening to the scientists, listening to science. We've heard this so many times. But Dr. Levine, I fear, is going to put a transgender ideology first ahead of biological realities, which, of course, matter tremendously when it comes to the practice of medicine, the advancement of science. I dealt with this issue extensively when I was at HHS. We rolled back a transgender mandate under Obamacare. We examined all the science. HHS itself has said that it's not going to issue a national coverage determination for sex reassignment surgeries because the data is not in. It's not enough to support it. Yet I'm afraid that Dr. Levine will come in with an agenda to start radicalizing the practice of medicine to pursue this ideology that's not supported by sufficient science.
Does Dr. Levine have a history? We know that his own story of changing genders, but is there a history there of activism while in public service on these issues?
Oh, most certainly. So when I was examining this question of what to do with the transgender mandate under Obama, I actually invited the leading names in transgender medicine. That included Dr. Rachel Levine. And we met at HHS. I heard that same presentation that Levine offered Senator Paul at the hearing when being questioned about what about cross-sex hormones and surgery on minors. The answer was, oh, it's a complicated issue. I'll give you a briefing, Senator Paul. I had that briefing when I was at HHS. I heard it directly. And the answer was yes, minors should be given cross-sex hormones and surgery when they have gender dysphoria. This should come as no surprise to anybody that Dr. Levine would take this position. The activism runs deep. It was, I think, evasive to the point of being disingenuous not to answer Senator Paul when asked directly, when I knew what the answer was because I heard it when the shoe was on the other foot, and those doctors wanted to keep the Obama transgender mandate in place. This is scary times when we're going to see this push, especially when it comes to minor children, 12 to 18, to have radical surgeries that will sterilize them, and you cannot turn back. And I'm afraid that's where HHS may be going if Levine gets confirmed.
I think that's important to highlight this point, the evasiveness. And I want to see, Bobby, maybe you can set up clip number 3. But this is the response in this exchange. I'm not going to play we don't have time to play the whole question, the whole statement from Senator Paul. But this is Levine's response to Senator Paul's question about whether children should be allowed to do this. Let's listen.
Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
So, Roger, are you of the position that Levine has a stronger position, a clearer position on the issue than we saw there?
I heard it directly. When I asked the question, what about children and minors and adolescents? And we had this very respectful discussion on what is the state of the treatments. And yes, indeed, all the doctors there, including Levine, affirmed that it is indicated for minors, adolescents, that you could do these permanent cross-sex hormones that deepen the person's voice if you're female, that start changing the secondary sex characteristics, and could lead to sterility, and including permanent surgeries. Now, of course, everybody needs to be treated with respect and with dignity, Everybody needs to be shown kindness and compassion. The question is there only one possible answer to this question? That you go running downhill towards permanent surgeries and hormones, even sometimes against the wishes of the parents. I think that's a wrong choice for public policy and certainly not for healthcare. And I'm afraid with Levine, that's the direction we're going.
Yeah, in the next segment, we're actually going to speak to a state lawmaker from Arkansas who is sponsoring legislation to prevent that from happening for minors. But Roger, based on your experience in HHS, given what you know and what you're telling us about Levine's history and in the likelihood that this will be a priority, what power will he have to actually affect policy around the country? What changes could be made from within HHS that would see this become more common?
Oh, well, the Office of the Assistant Secretary for Health, this is the position. It's effectively the top doctor. And you've heard the Surgeon General. Surgeon General is the top doctor that's public-facing, public advocacy. This is the top doctor that really has the biggest impact on the programs and what is getting funded. The Office of Women's Health is under the Office of the Assistant Secretary for Health, and of Youth and Adolescent Health as well. These are the programs where so much federal money goes towards, and it should be driven by science, not by ideology. Imagine, what does it mean to have the head of the Office of Women's Health be influenced by a notion that it doesn't really matter what your biology is, that men could actually get pregnant, which is in fact standard now as transgender ideology. If you identify as male, you can still get pregnant. I mean, what does that do to the practice of medicine?
No, you make a really good point, and we don't have time to get it, but the implications for those who would disagree with this within the agency and within the country are also things that we have a lot of concern about. But Roger Severino, thank you so much for taking your time. I know we will call on you again on this important subject. Thanks for your time today.